Hi everyone, this is Whitney here. I'm the bariatric nurse practitioner. I wanted to talk today about the importance of vitamins in bariatric surgery post-operative patients. I get a lot of stories from people that don't really make a lot of sense to me from my training standpoint, and so I thought that it might be helpful to kind of talk about the anatomy and physiology of each of the procedures and why vitamin supplementation is so important and why it needs to be very targeted and specific. I see a lot of patients over the years. I've been doing this about 20 years, working exclusively with the bariatric post-operative patient population who maybe were taught to, take a Flintstone vitamin, or maybe not told to take vitamins at all. And they end up with serious issues and problems. And many of them didn't even really recognize that their issues were as a result of vitamin deficiencies. Things like neuropathies, brain fog, memory loss, poor energy, just things that they were attributing to getting older or to other issues when really it was preventable by just understanding their operation that they had and knowing what they needed to do to prevent issues from occurring long term. So I thought I would just go through the surgeries. I'm going to talk about the gastric bypass and the sleeve gastrectomy today. Just walk you through the anatomy kind of quickly and help you understand why vitamins become important after you have this operation, because your digestion is really kind of broken in a sense. And so while the broken digestion has great, wonderful, powerful impacts for weight loss, for hormones, for lack of hunger, for impacting insulin resistance and diabetes, it's going to have other consequences. And so as long as you know what they are and you understand them, then you can prevent any of the negative side effects from them. So let's start with the gastric bypass. I have a diagram here that shows kind of what it looks like on the inside after the bypass is completed. Now remember, with bypass, nothing's being removed from the body. Everything's left inside the body. It's just kind of rerouted or replumbed. So we have here this new stomach pouch that's created from your existing stomach that's in the body. Obviously this is much reduced in volume, so it's going to be, you're going to be able to take in much less food, right? And so along with this disconnected stomach that's left in the body, so this is surgically closed, along with that piece of stomach, they come down the first portion of the small intestines and cut at the bottom of the first portion where the second portion of small intestine is starting. And they bring up the second portion to connect to the stomach pouch. So when you have, after this operation, you have food coming in through your mouth up here, down the esophagus. It goes into this small receiving chamber or this small little stomach pouch, and then it leaves and it goes into the second portion of small intestine. It has no longer any contact with this disconnected stomach or this first portion of small intestine here, okay? So the intestine is connected back into itself here, so that we have stomach acid that's being made here in this disconnected stomach. We have the gallbladder or the liver is putting in bile into this piece of intestine. The pancreas is putting in pancreatic enzymes into this piece of intestine. And those are needed for digestion of food, right? So they're going to still come into this piece of intestine, even though this piece is no longer receiving food. They're just going to meet up with food where it was reconnected later down the line of intestines. So digestion really is going to begin down here instead of up here where it used to. So food's going to travel all the way down this piece of intestine and not meet up with digestive secretions to help break down food until here. This is powerful in terms of hormonal changes that decrease the hunger hormone ghrelin, increase the hormone leptin, which helps us feel fuller, easier, quicker. Some of the other manifestations of this anatomy, the creation of this bypass, because we're bypassing this piece of intestine, is that this piece of intestine, again, no longer receiving food, is the primary place of some vitamins and minerals. It's the primary place where they're absorbed. So we're talking about minerals like calcium, we're talking about minerals like some iron. There's a majority of vitamins are absorbed at least somewhat in this piece of intestine. So now when the vitamins from food go through this piece of intestine, there's going to be decreased absorption from those vitamins from the food, because this piece of intestine is only able to absorb a portion of the vitamins coming in, because historically this piece absorbed a lot of them, right? So you have malabsorption to nutrients that create the need to have vitamin and mineral supplementation. And that's not just for a little bit, it's forever. The second kind of reason why vitamins are needed is because this piece of stomach, this very tiny piece, is only making a tiny bit of stomach acid. And stomach acid is needed to break down certain vitamins and minerals, okay? It's needed to break down typical over-the-counter vitamins that are cheaply made, ones that contain minerals such as oxide, so magnesium oxide or iron oxide, things like calcium carbonate. These require high amounts of stomach acid in order to break down these molecules and allow for the molecules to be absorbed by the body. Okay, so we're talking about specific nutrients that we need based on this piece of intestine being bypassed. We're talking about specific chemical structures of nutrients based on the decreased amount of stomach acid that's present to mix with the vitamins in order to break them down. Okay, and then third, probably most logical to most, is that we are taking in far less in food volume than before. Already, the standard American diet is very deficient in vitamins and minerals. This has to do with not only the food industry making highly processed food. Standard American diet is high in processed sugar, processed flour, and fast food is very common. We also use a lot of pesticides and industrial farming practices, which deplete our soil of the nutrients. So unless you're kind of organically growing your own fruits and vegetables in a sustainable farming practice on your own land, where you're rotating crops and maybe you have some cows that are kind of, helping to fertilize the soil, and you're able to kind of eat, 5 servings of fruits and vegetables a day, you're not getting the nutrients that you need. Okay, so particularly after bypass, when your capacity is so limited for what you can take in, vitamins are going to be necessary forever. All right, so that is kind of a little bit about the why vitamins are important. I can't understate this enough. It's the number one area of focus that I work with patients on. I test a ton of vitamin levels. I often find many of them either suboptimal or overtly deficient. And that's in people that are not taking proper supplementation. So no, Flintstones will not cut it. You might get by for a couple months. Some vitamins are stored up for a couple months in the liver and we can survive on what we have stored, but we don't have a pantry in our body of vitamins to pull from when we need them, okay? So if we don't take them in, we are going to become deficient at some point in time. So deficiencies, I could just talk for an hour and a half on a lecture of all of the different sequelae or consequences or symptoms of different vitamin deficiencies, but let's just say that they're important for our immune health, for making hormones, for clearing hormones, for handling our body's stress reactions like our epinephrine and norepinephrine. And without going into too much biochemistry here, you need them in order to operate and function. Every system in the body requires vitamins and minerals, okay? So it's super important. And hopefully I've kind of helped you understand that it is important. You can't just take anything you grab or what might be buy one, get one free at Walgreens, okay? Because you have to accommodate for the fact that certain vitamins are going to need to be in super high doses in order to make up for the lack of absorption that you have, while others may have not as much an impact. So you don't need super high doses of those, okay? So you need a formula that's been kind of made for a bariatric patient. So you have really high levels of certain things that you need, normal levels of things that are not impacted by the bypass, and in the right chemical structures, things that are going to be broken down even without stomach acid. And so that's why we kind of recommend a bariatric line supplement. We designed the building block supplement over 20 years ago when we were starting out doing bariatric surgery, and there were no options on the market for patients. And so I was literally counseling patients coming in with bagfuls of supplements, and they were saying, you know, how is this? What do you think of this? And none of them really worked because something would be in the wrong format. Something would be, if they said, well, if I take 4 of these, yes, but then you'd be getting too much of certain things in order to get enough of others. And so we recognized the need and hired a biochemist who was a specialist in obesity and in weight loss surgery, who understood the chemistry, and she helped us formulate bariatric specific vitamins, okay? And these vitamins are in line with the bariatric guidelines for the American Society of Metabolic and Bariatric Surgery. There's published research to say what amounts vitamins, specific vitamins and minerals people need, and that's how these have been designed, okay? So we of course recommend the building blocks line because that's what we've used for 20 years and we know the results. We can easily look at lab results and tell whether a person is taking our vitamins or taking Flintstones. It's not hard to tell. Now today, of course, there are multiple other lines available. There's more competition in the market. So, I'm just going to encourage people to, first and foremost, we want you to take what you're willing and able to take, but it's not really going to save you money to buy a Flintstones only to find out that based on your labs, you need to add in 5 separate vitamins. That in the long run, you could have just taken the 1 or 2 supplements in the line and had that all covered, okay? So I'm gonna flip over to the sleeve gastrectomy because this is, gaining a lot of popularity. It's being done pretty commonly. But the misconception with the sleeve is that, because we're not altering the digestive tract, there's less of a risk for vitamin and mineral deficiencies. And that's really, really false, and it's a dangerous thought process. And I wanna really dispel that and show you why that is. It's a different mechanism, and patients are more at risk for deficiencies in certain vitamins, different than in the bypass. But the reason that vitamins are needed in sleeve gastrectomy is that in this operation, you're actually having 80% of your stomach physically removed from the body. So this whole portion of stomach right here is removed, gone, and you're left with this little tube of stomach. And then you do have all of your intact intestines the way that they were originally made, okay? So no alteration in intestines, but major alteration in the digestive tract, okay? Because when you're removing 80% of the stomach, you're also removing 80% of the stomach acid that's made in the stomach. So now you're left with very little stomach acid. Again, similar to in the bypass, we have much decreased stomach acid. And in stomach acid, there is a factor that's needed for vitamin B12 absorption called intrinsic factor. So sleeve gastrectomy patients, we're going to be worried about vitamin B12 deficiency significantly. And there's stomach acid is also needed for iron breakdown, to take the iron mineral and break it down so that the body can use it. And so we're going to have decreased absorption of iron and B12. But then we also have the other factors, such as with stomach acid being decreased, we cannot break down cheap and any molecule of vitamin and mineral. We can't use oxide. We can't use things that have a lot of binders and fillers that require strong stomach acid in order to break all of those down. Okay, and then of course, massive restriction here, restriction to food intake. So we're eating smaller portions. Our diets may be restricted in terms of maybe there's certain food groups that you don't tolerate well or don't sit well, and so you avoid those. And so for all of these reasons, as I discussed earlier, we just are not going to get in the complete vitamins and minerals that our body's going to require without the use of supplementation. So I hope this kind of helps give you encouragement to get on some good vitamin and mineral programs. You can, talk to your bariatric team about what specific vitamins you require. It should always be based on your surgery type and what the guidelines state that you should be on. That's going to prevent deficiencies in most people. But everyone's a unique individual, right? So everyone's going to have different medications they take, different food preferences. They're going to have different diseases that require different higher levels of certain nutrients and maybe burn through them. So, getting your blood work done annually and getting the full bariatric panel of labs is invaluable, because if you don't have them, you don't know. And if you don't know, you are going to start developing symptoms and not be able to figure out why. And you might end up seeing specialists and getting all of these workups to pinpoint why you're having these symptoms of depression and heartburn and numbness and tingling in your fingers and toes, when really it was all because of magnesium or vitamin B12. Okay, so I hope this was helpful, and please take your vitamins, guys.